New York Governor Andrew Cuomo believes the worst is likely over in his state, the nation's white-hot center of the outbreak. He's also launched an initiative with 6 other governors to coordinate efforts and develop strategies for reopening aspects of the regional economy. And Governor Cuomo is joining us now. Good morning, Governor.
Good morning, Hoda. Good to be with you.
Good to be with you. You talked about some good news here in New York. You said we reached a plateau. The death toll has flattened. The number of intubated patients is on the decline. So a lot of people may be saying, well, phew, this thing is over. Is it over?
It is not over. All we've done, which is a significant step, we have shown that we can stop the spread of the virus, right? We were looking at those lines that were continuing to go up, and there was a big question, can you stop the spread of this beast? And we have done that. You closed everything down, and it worked. And the quote-unquote plateau is a flattening of the increase. It's not a decline. It's just a flattening of the increase. So we have to keep that in mind. And we have to remember, Hoda, we did this by our behavior. This was not natural. All the projections were much worse than what actually happened because our behavior worked. If we stop doing what we're doing, you will see those numbers go up again. Period.
Let's talk about reopening the economy. I think everyone wants that to happen, but the question is, when is it going to happen? How is it going to happen? And who says it's going to happen? Well, yesterday, the president at his news conference, and this is his quote, he said he has the power. He says when someone is president of the United States, the authority is total. He said it was total. And he said the governors know that. Do you know that?
Nope. I don't know what the president is talking about, frankly. We have a Constitution. The Constitution is based on balance of powers. You have to remember it's the states that created the federal government, right? It's the colonies that created the federal government, not the other way around. And we don't have a king. We have a president. And that was a big decision. We ran away from having a king, and George Washington was president, not King Washington. So the president doesn't have total authority. The Constitution is there. 10th Amendment is there. Number of cases over the years. It's very clear. States have power by the 10th Amendment. And the president is just wrong on that point.
Okay, so if the president says, let's open New York, and you say you don't think it's a good idea, what happens then?
Look, if he pushed it to that absurd point, then we would have a problem. If he thinks he's going to force this state or any state, for that matter, to do something that is reckless or irresponsible, that could endanger human life, literally. Because if we don't reopen correctly, you will see those virus numbers go up again, and more people will die.
Let's talk about...
And we paid a heck of a price to get the...
Yeah, let's talk about reopening correctly, because I think that this is a big deal. You're teaming up with 6 other governors from the Northeast. But, I mean, I'm sitting here thinking about reopening a city or a state, and it seems like the only way you can do that is if you have testing to find out who's safe enough or who's well enough to go back to work. And the idea of widespread testing doesn't even seem like a possibility. So how do you even start?
Yeah. You put your finger right on it. First of all, nobody's done this before. It has to be phased. It has to be balanced. It's a public health strategy and an economic reactivation strategy. And the key to me is testing. And people have to know that they are safe, and the testing actually works to make people feel safe. And we don't have that capacity now. And the states can't do it on their own. We have to develop that widespread testing capacity. The way on the first go-around, we had to develop additional hospital capacity. Testing is going to be key, and we are not there yet, but that has to be developed.
And do you have, Governor, any kind of a time frame about what we're looking at? I mean, Savannah was just asking an expert about businesses opening, going to ball games. I was just thinking about concerts on our plaza in the summer. We always have summer concerts on the plaza. Do you have any idea of a time frame of when all of that may start to look like normal again?
Hoda, I don't. And I think if anybody tells you they do, they don't understand the issue ahead of us. This is all uncharted territory. You have to feel the way it goes. You have to start to reopen with a plan. an informed plan that actually improves on the situation and learns the lessons. But then you have to watch the number of infections. You tell me how New Yorkers or Americans behave today, I'll tell you the infection rate in 3 days. It's that cause and effect. And as we reopen and everybody wants to get out of their home and everybody wants to get back to work, if we don't do it gradually and controlled, you'll see the viruses go up, and that would be a terrible shame, and then we'd have to start all over again.
All right, New York Governor Andrew Cuomo, thank you for your time. We appreciate you.